Welcome, everybody. Thank you so much for joining for the Health, part 2 of our ongoing conversation on race and food allergy. I'm Karen Palmer. I'm a certified professional coach and a food allergy parent, and I'm thrilled to welcome you all here today. I'd like to take a moment to thank all of our sponsors for this webinar: Spokin, the Center for Allergy and Asthma Research at Northwestern University, the Natalie, the Natalie Giorgi Sunshine Foundation, Enjoy Life Foods, and of course our host, the Food Equality Initiative, the organization that has brought us all here today. So before we get started, I would like to let you know that this webinar is being recorded and that all participants are muted in order to prevent any unwelcome distractions. The team at Food Equality Initiative will send links from the resources from this webinar to everybody who has registered after the event is over. So please feel free to use the chat function to share any questions you'd like to ask any member of our panel. We will have time for Q&A later in the program. So we have a lot to cover in the next hour. Some of the things we'd like to touch on include what it means to be an ally to Black families within the larger food allergy community, actionable steps for industry and community organizations that might be interested in creating a more inclusive food allergy community, and what kind of factors go into creating an equitable and productive partnership in the food allergy space from both the community and the ally perspective. So now I would like to introduce our panelists this morning: Dr. Rucci Gupta, a board-certified pediatrician and the director of the Center for Allergy and Asthma Research at Northwestern University; Dan Waters, the CEO of Enjoy Life Foods, which is one of the most recognizable brands serving customers with food allergies; Susie Hultquist of Spokin, the app that connects users with an absolute wealth of information from allergy-friendly recipes, restaurants, hotels, and more; Louis and Joanne Giorgi of the Natalie Giorgi Sunshine Foundation, a philanthropic organization that is devoted to reducing the number of food allergy deaths by spreading public awareness; and last but certainly not least, our host, Emily Brown, founder and CEO of Food Equality Initiative. Good morning, everybody.
Good morning.
Morning.
Hello. So today's conversation centers on how the food allergy community can support positive change for Black families who are managing food allergies. A big part of that change is creating, developing a network of allies whose partnership can help families really navigate these challenges more successfully and overcome barriers to quality health care, which are, pretty much endemic among communities of color. Emily, you see all of the organizations that are represented here today as allies of Food Equality Initiative, FEI. And what is it about them that makes them key members of your community of care?
I think I expressed in my open letter to the food allergy community that my experience as a Black mother navigating the food allergy community, that I often felt voiceless, not visible. And I know that's an experience that many Black families and other minority families feel as they're navigating the food allergy community. And each of these organizations and individuals has been an ally to me and to Food Equality Initiative in a number of ways. The first way, I think, really is simply by taking action. Each of these individuals, when they heard my story, or we, as an organization, we reached out, they offered, assistance, and, they opened doors. They took action. They didn't just say, that's really great what you're doing, and, just continue on with whatever they were doing. They, brought me into the fold, and not only did they take action, but they, empowered me. They lifted and amplified my voice. And that's been done in many ways. And each of these individuals has done that. I know Dr. Gupta, we've published a paper together, but even before that, really looking for opportunities to elevate our work. I can say the same thing for Susie, who has, both very publicly and privately made introductions and just, made a way for us. And, Enjoy Life Foods has been a partner with our work from the beginning, before we even opened our first pantry and we were doing cold calls. You know, they're one of the organizations that stepped up and has been a partner along the way. And, you know, so we're really grateful for that. And I can say the same thing for Lewis and Joanne and the work that they're doing with the Natalie Giorgi Sunshine Foundation. Each of these organizations have shared resources, and you know, these are all aspects of being a good ally.
So in terms of the creation of these relationships, we understand that, again, when people are, representing a business, representing an organization, anything from, an industry to a philanthropy, folks make choices about how they partner with folks. And in terms of where you see the value in the space of connecting with Black-led organizations, what does that look like for you in terms of what allies get from relationships like this?
I think it's important to remember that these relationships are mutually beneficial, that there's value on both ends, and that, you know, it's also in this day and age, I think there has been a shift with COVID and the tragedy of George Floyd. I'd even go on to say that it's not just mutually beneficial in that, we feel good, we're doing the right thing, but I'd even say it's really what consumers expect in both the marketplace and what patients and families are expecting, from their providers and from their community. I think we're living in a time where people are holding institutions accountable, companies accountable for their actions. So it's not only beneficial in that feel-good way, it's good business.
Mm-hmm.
Thank you, Emily. I'd love to turn to our panelists now. Ruchi, I'm going to start with you. You and Emily first started talking way back in the infancy of FEI, as Emily pointed out. I think it was 2014. I would love to know how you all first got connected.
2014, Emily. Huh, I didn't realize that it had been quite that long. Well, Emily is just an incredible force, and I personally have, been very interested in this space. And when I met Emily, she's the first person I met who was really focused on improving disparities and reducing, the barriers around getting safe foods to all families that need it. And I was really blown away because she was doing this grassroots on her own, just, pushing and developing and making things happen. And so obviously I wanted to get behind her and join her team immediately, which I think I have done. And, one of the biggest things for me as a researcher, you have to think about where you are and how you can help. And as a researcher, I think I wanted to get Emily published because this data that she's collecting about the needs, we all know it exists. Everybody knows it exists, right? But the hard part is getting policy to change and action to happen often takes us publishing that data and putting it out there. I say, most of the time, most of our research is common sense research, right? It's just, yes, we know food allergies are a big deal. Yes, we know they're quite prevalent, but until you get to those numbers and the cost numbers and economic numbers, the policymakers don't really listen. So elevating Emily's voice from the standpoint of how can we help in terms of getting the data she's showing out through research to be able to then take that and make the larger policy changes that she envisions became one of my goals.
So, obviously, as Emily pointed out, this is a two-way relationship. With the data that Emily and FEI have been able to provide you, what kind of major discoveries have you made, in this area of research?
Yeah, well, I think one big thing is really presenting the need, right? Because a lot of people will say, oh, well, it's not really needed. We don't get a lot of requests, right? Emily and I have talked about this. No one's asking for these types of foods or safe foods, or we can just substitute it with, another can of beans, as Emily teaches me. So I think for both of us, better understanding what the needs are, and then what she's discovered is how do we resolve them, right? There are ways we can make change happen to fix this and to be able to provide healthy, safe foods to all families. And that is something that I feel Emily is one of the only people in the country that has the data around that and the ideas around how to make that happen. And so I think, you know, the couple things that we are working on together is identifying those needs in the population, identifying how best to serve the population, right? Like, is it coming into food pantries? I walked through a food pantry and she described to me and taught me every possible barrier, you know, to getting those safe foods to families. So she has some great ideas, and, you know, we got to get policymakers involved, because this has to be something that not only she does as an individual, but this translates into larger policy through WIC and governmental agencies, and people understanding and identifying that people do have food conditions that are very serious and that they do need safe but also healthy food.
So, I mean, this really has affected the way you see doing the research itself. I mean, what kind of lesson would you want other people working in research, conducting studies, to take away from the impact of being able to use the data that Emily is giving you?
So we are working right now with the Quad AI and allergy organizations to include questions about food insecurity when allergists, even, you know, pediatricians, you know, it started happening with pediatrics, you know, there are some food insecurity questions that we're really trying to push into the conversations that pediatricians have with their families, but then translating that to allergy, right? Once you identify a food condition in an individual, how do you make sure that they're able to get safe foods? How do you ask those questions? And then how do you, you know, it's not only asking, it's like, okay, well, what's the option if they tell you no? How do you get them the resources they need? So all of those steps need to happen. First, the questions need to be asked. First, there has to be awareness that this is actually an issue. And then the right questions need to be asked. And then the resources need to be available for people to access safe, quality foods. So yes, we have a long way to go, but we're going to get there. And I am encouraged by this momentum and everybody listening and participating, because, you know, we need to make change happen now, and we have the ability now with so much support in Emily's leadership. So excited about it.
Thank you for sharing that. I'm going to put a pin in that because you said a couple of things I would love to come back to a little bit later, but I'd love to move along and jump in with Susie. Susie, your work and Emily's work both concentrate directly on getting resources into the hands of families with very serious food allergy needs. I understand there's a connection between Food Equality Initiative and an initiative that you launched, a fundraising campaign this spring called Spokin Cares, and I'd love to find out about how that came about.
Yeah, you know, we saw Emily's work and really admired it from afar. And last fall, we put together a list of the top 100 women in the food allergy community. And Emily was on that list. And I had really only just learned about her and was in such admiration. In fact, I think we were at an event together and I was trying to track her down. Like, she was like a celebrity to me in the work that she was doing, but I didn't get a chance to meet her. And she was always in the back of my mind as someone I just really admired what she had done. And when the pandemic hit, I don't know about anybody else, but I was like with my family, stress eating cookie dough and anything I get my hands on. And we were putting out recipe guides about, you know, banana bread and all these foods and cinnamon rolls and, you know, just, and there was a moment that all came together. It was a weekend that I got an email from Ruchi talking about looking to, you know, put grants to work for people helping communities in need. And this is no joke, I don't mean to make light of it, but like couldn't zip my pants because I've eaten so much. And she's looking for help for people with need. And I'm thinking about a quote that I just saw that Emily put out. And Ruchi, you say everybody knows, but I don't know if everybody knows it at the surface level. You know, there was a quote from Emily and we shared it. It said there's 60,000 food pantries and only 4 accommodate food allergies. And it was like, I couldn't unknow that fact. And in this one weekend, you know, it was one of those shower moments, sorry for the visual, but you're thinking, and I'm like, Ruchi's looking for help. I can't zip my pants. And there's this woman, Emily, who just came out with this quote. And I reached out. We have a very robust active ambassador group, and we reached out. We've got some young adults, we've got moms, we have teens. And I said, would you guys want to do something? There's something going on with the food pantries with people with food allergies. Would you be okay? Would you be interested if we did something to try to help? And it was like one of the most, strong responses we've ever gotten across the board. Everybody was like, yes, yes. And I felt like we were in this leadership position to do something. I felt as a human, I wanted to do something. I felt like we could do something. And so we actually reached out to Emily on a Sunday. I'll never forget this. And she made time for us on a Monday morning. And I said to her, I feel like a writer on her team was there. And I said, I feel like I'm talking to a celebrity, so I'm a little nervous. It felt like such an honor to talk to her with the work she's done. I said, could we have the honor of trying to help you? Could we start something? I feel like we could do it. We have the largest, fastest growing, direct to consumer engaging platform with food allergy community. And our guardrail is very clear. Can we help people? Is this going to help people with food allergies? And living with food allergies, my daughter has life-threatening food allergies, you're vulnerable. Well, there's nobody more vulnerable than the food insecure. And as we start to learn the information about where they stood pre-pandemic, we could only imagine how horribly accelerated the need would be post-pandemic, in the midst of the pandemic, given unemployment rates. And so it was a Monday decision. She said yes, graciously. And by Thursday, we launched the campaign. And the entire team I'm not a one-person show. The entire team, I think we worked, 20 hours a day to make this happen. We reach out. We have a lot of food partners that pay us to be on the Spokin app. And we went to all of them and said, we think there's a place for you. Can you do something? We asked all of our ambassadors, can you share? And we try to get the information while everybody kind of knows everybody is consumed with everything in their own life. We try to communicate the information, $5 by 3 meals. We try to say 60,000 pantries, 4 accommodated food allergies. How do you get the attention of people with the world on Instagram, the world on Insta stories? How do you get to them and communicate it? And it led to, I'm kind of like welling up actually when you're talking, Karen, because it's been such an honor, frankly, and one of the greatest privileges I've ever had in the history of the company to be able to help. And I would say the morale for the company, we have to stop and say, we have investors. Do they want us to do this? And, we're using resources. And I got it, we got the team together and just said, of course, like if you don't have the ability to help people, like then you're nothing as a company, in my opinion. And not to be too strong about it, but it was like, I sat each of my children down and I had them donate. Take a look at this link, make a decision for yourself. I'm asking you to give at least $5, make the decision. And we really it started, what started was not just a campaign that would have one day or 1 week. We have used, and Emily knows this, I really felt like I have been the beneficiary of people who've helped me my whole life, my whole career, having come from Wall Street. And I did open my Rolodex in any way that I could to the CEOs of some of the biggest food companies and pharma companies out there. And I sent an email that later I had to share with Emily. And I said, I hope you take this with respect, because I actually wrote in the email, and this is pre-George Floyd and the awakening of the country. I wrote in the email, this is a Black woman in the Midwest who had to go to a food pantry herself. She needs our help. And I was a little nervous because there was a situation where I had to forward the email to Emily, and I said, I hope you take this with respect. I'm trying to do what I can to help, and I don't want to hide behind the situation. I really want to rally people, and a lot of people rallied before it was the right thing to do, and companies were watching. I think, I'm sorry if I'm talking too long, but it was just, it's just been such an honor. I'm so in awe of Emily. I consider her an incredible friend. I'm so excited for the food allergy community to come and join forces to help the people who need our help the most. So it's just been something that we'll do forever. And whenever we can make an introduction that we see there's a fit and everybody is a fit, we try to do everything we can to pass that along and support whatever we can.
Oh, thank you, Susie. I mean, I think lots of thoughts have popped up in there that we'll come back to in the back half of the program, but thank you for sharing that story. Dan, I'd love to tap you next. You run one of the most well-known free from brands, as we call them, within the food allergy community. Enjoy Life Foods has had a long-standing relationship with FEI. And as an industry partner, how do you see using your resources to support organizations like FEI, other organizations as well that support the Black community's interests within food allergy?
Yeah, sure. And, again, thanks for having me today. It's certainly an honor to be here, both as a representative of Enjoy Life, but also I think as a lot of us, right, a food allergy parent, right? So I come to this not from, I come to this at this organization from kind of both sides of the coin, so to speak. And I think, when we think at Enjoy Life, what we are trying to do, right? We are trying to make, in an ideal world, right? Our business doesn't exist because everybody's free of food allergies. Until that point, right? Our mission is about making sure that people have the freedom to enjoy, all types of foods, right? And I think it's really important because we're not saying a certain set of people should be able to enjoy it, right? It's everyone should feel free of this worry, right? And I know that worry. I've done, I think 4 or 5 sets of EpiPens on my son. So I know what that feels like. I think for a company like ours, right, I think there are kind of, 3 areas that we focus on, right? One is easy, right? One is about product and being able to make sure, we donate product, we're able to donate money. So that's the easy part, right? For us, I think the couple of things that we have done, and I think, we'll talk a lot about doing better. But, there is a huge community of our consumers that we can leverage to be able to go out, to be able to speak to, right? I think so much is about awareness, right? I mean, again, I'm 90 days into this job. So, Emily and I had a chance to meet, about a month ago. And I think similar to, to Susie, some of the facts that, she rattles off, and this is coming from an allergy parent. I was, it was like picking my jaw up off of the table, just because it's just things that I wasn't aware of. And I think, this is a community that is so passionate and speaks with such engagement. I think we can do a lot of work with energizing our community from awareness. I think the third part of that is, awareness is great, but we need to do the job of helping people like Emily and helping FEI be able to push towards action, right? So, this is sort of the question I had for Emily was, okay, so what can we do, right? What are we asking our community to do? And I think, Susie, that's to your point about, here, take this small action and this can help. Because I think that's this, I think Karen, when you and I were talking before, it was, okay, I think our job collectively is, is how do we take this moment and make it into a movement? And I think it's going to be very much about sustained action from companies like ours and others.
I appreciate that, Dan. You just mentioned, all of the sort of the feeling in the air, post George Floyd's murder. Emily had referred to the letter that she wrote, the open letter to the food allergy community. And something that stuck with me, and I think a lot of other folks, is that when you, wrote and published a statement on behalf of Enjoy Life, you specifically, as you just said, you referred to, we can and will do better in this area of, raising awareness and making a commitment to serving, the Black community within, the larger food allergy community. And so I wanted to know, you've described some of what doing better looks like to you. What specific message did you want Enjoy Life's consumers to take away when you published that?
Yeah, I think, for us, I think it gets back very similar to what, what we just talked about, but it's first is about awareness and making sure that all of our consumers understand, that this issue is, it cuts across every slice of humanity. And I think, to make sure that they fully understand that, I think, the other part is, there's so much right now about, I talked to a lot about our team and about doing better, and started that as just to listen, right? I mean, again, it's like trying to be able to listen and to be able to find the right partners from which to take action from. And, you know, the last two things that I think about doing better for me, one is very tactical and one is, you know, I think, you know, a bit further on is, you know, when we think tactically, you know, back to, you know, the number of points have been made. We know the big challenge in America around sort of availability of food, you know, food deserts, et cetera, right? Again, that gets, you know, when you take a food desert, right, I can virtually guarantee you that in a lot of Black communities in America, our products aren't available, right? Just, it's not that they're, I mean, so we, you know, there's a question that we need to do better work on driving better value for all of our consumers, but it has to start with absolute availability, right? Whether that's in store or within, you know, within food pantries with Emily as well. So that's a core focus that I've tasked our team with, identifying how do we, you know, start to solve that problem, right? And how do we start to solve that, you know, in individual communities, as opposed to, you know, solving food deserts is a big challenge, of course, that it's going to take the industry to do. And then I think that the larger point for me is, you know, is how to make sure, right, that we take a set of issues and invest in them as an organization, you know, what I would say longitudinally, right? So what one of the things that, you know, Emily had said, and I share this very candidly with everyone, she said, you know, we have had a very good relationship with Enjoy Life, and then we haven't heard from you in a while. And, you know, my commitment to her and my belief is, we need to, this is a decades long effort, not a months long effort. And so I think for us, doing better is making sure that, you know, if we were to all check back in, right, on the same, you know, Zoom, everybody, you know, 6 months from now, you know, what I want people to hold us accountable for is, what are you still doing? Like, what are you doing more of? What have we learned? And I think that's the dedication that we have to have as an organization, because I think, as you've all said, right, there's not a button we need to push here to solve the problem, right? It needs to take some time and investment and thought.
No, and, you know, I love the idea of what you put out there of, you know, the thought that this shouldn't just be a moment, that it should be a movement. And that requires that people not only think differently, but continue to sustain that energy that for some people started in the streets, for some people just started with the, you know, discovery of the video and the related conversations, but that this is really just a beginning point on a much longer road, no matter what perspective you're coming from. So thank you for sharing all of that. Joanne and Lewis, good morning. I wanted to ask Joanne, how you all became aware of the work that Food Equality Initiative was doing, you know, and how you decided to get involved.
So we had been hearing about Emily. I'd actually heard about the work that she was doing at FEI probably a little bit over a year ago. And it was from a PSA that we had worked on with and Allergies together that was targeted. It was the spelled out PSA for the underserved communities. And from both Elise Bates and Erin Malawar, I kept hearing snippets of, and all this great work that Emily's doing. And similar to Susie, I was like, I got to meet this person. You know, you wanted to figure out specifically what was she doing. And, you know, we didn't know Emily personally. And then again, probably right around the start of the pandemic, so maybe late March, early April, when we started seeing what Susie was doing with Spokin Cares, again, it just put it to the forefront. And I actually asked for an introduction through Erin Malawar at Allergy Strong, and she made an introduction to us. And right away, put us in touch, gave us Emily's email, and Emily responded right away because we had wanted to speak with her. We were having some other requests for some grant funding, and we really felt like we wanted to do our due diligence. And Emily's name we'd been hearing. Everybody kept saying she's the gold standard of this place, of who's helping those who need the resources the most within our community. And so it was that simple. It started with an email and kind of started the ball. I went back and looked. I think that was maybe April 17th was that first conversation that we had. So.
So, I mean, you all have committed to, essentially a partnership with FEI. I mean, at a time when, there are severe economic challenges, for organizations like this. Louis, as a funder, what kinds of things went into that decision to decide that, FEI was the kind of organization that you wanted to be formally allied with? What made it worth the investment?
Well, I think when we first met with Emily, we realized, first of all, her competence, her plan. She was in the space. She understood the space. She knew the promises and the pitfalls. It was tangible. It's scalable and immediate. And so we always recognized the need that things weren't fair. And the disparities were always so evident on care and on access to foods and the costs and all those kind of things. And when we saw how brightly her star shone and seeing all the other stars that are on this panel, it made us feel that we needed to be a humble part of that constellation. And we wanted to, certainly scale with Emily, help her scale and make the difference throughout the.
Which is wonderful. I think, the challenges of and the complexity of the kind of work that FEI is doing, requires support in a lot of different ways. I think certainly within the Black community, people who are entrepreneurs, who are innovators, who are folks who are trying to make change, you may have command of your specific area, but you don't necessarily have the ability to raise it to the next level of either awareness or effectiveness. And so the input that comes from folks like yourselves is, really life-changing in, that sort of work of an organization. But again, I want to come back to some of that, and I'm keeping my eye on the clock. I would love to open this up to, some questions from our folks who are watching. And I would also encourage all of you panelists, please feel free to crosstalk, because this is a conversation, and I feel like you all have insights that amplify, what's going on between you and in your individual places. Ruchi, I wanted to circle around to one thing that you raised, which is talking about the importance of the relationship between individual medical providers and families at the beginning of their food allergy cycle. I mean, we know how big the challenges are for those families who end up in the ER for the first time, and you find out your child has this life-threatening condition. What happens, and how can medical providers be more effective allies for folks who are at the beginning of this journey, who also have issues with resources and frankly with visibility and agency as members of the Black community?
Now that's a really great question. And, it actually takes me back to the reason, I got into research. As a resident in Seattle, I saw in asthma, my Black families and, like all the families I would take care of, but my Black families, even though I thought I was giving them equal care, I would see them in the emergency room or hospitalized more frequently. And it was very frustrating, because I'm like, what am I doing wrong? How am I not managing them at the same level? And why are they the ones that keep getting hospitalized, missing school, having all the negative consequences and exacerbations? And it was the reason where I was like, okay, can I do something as a pediatrician to reduce this, or can we figure out why it's happening and try to fix it? And so then I got introduced to food allergy, and I too am a food allergy parent, and it became my interest in food allergy, because when I started in food allergy, people didn't really know much about if disparities exist. But as all of you know, food allergy is related to asthma and eczema, which we do know there are significant disparities. So how could it not be in food allergy, And I'll tell you, some of my insights for Black families is we know they have more asthma. And a lot of times when they come to their provider, they discuss their asthma because they need their medications. And for food allergy, what ends up happening is you only have limited time, right, with each patient. And sometimes food allergies are not as important because there's no, inhaler for it. You avoid the food. And so I think that awareness for providers, what I've been encouraging is when you have a family, just ask. Ask if they have asthma, if they have eczema, are you avoiding any foods? Do any foods cause you any trouble? Because I think a lot of times it gets left out of the conversation. So, one of my one of my areas of interest is really identifying, what that is. And we know that Black families have higher rates of food allergy now. We know that they're not getting the management that they should. Many of them are not getting to allergists.
One thing that definitely comes out of that, just listening, is the idea that there is not only a racial component, but an economic component to what happens with families in these situations. And Emily, I wonder, because you see this on a regular basis, how does that affect people in terms of getting that medical care that Ruchi is talking about?
Well, I think it happens many different ways. It manifests in many different ways. One, I think while there's a standard of care for food allergy, I think if you don't have access to, to specialty care and you're only managing in primary care, and there is not, there's not a continuum of care for food allergy, then things fall through the gap. Just like Dr. Gupta said, they're coming, they're, getting their medication for asthma, but there's oftentimes foods that they're avoiding. And have those been formally diagnosed? Are we asking the questions? And that's also why, being aware of, potential implicit biases. It may not be conscious upfront of mind, but it could be deep down. And maybe that's why the questions are not being asked by providers. And so when we don't ask those questions, then we can't get to, the solutions that families need. And then, particularly around the work that we do, focus around the social determinants of health, that recognition that 80% of what's driving health outcomes happens in the community, and it's tied to things like access to healthy food, and particularly in a condition like food allergy, where for so long the prevailing treatment has been food avoidance. Access to that food is critical. And so I think Dr. Gupta touched on it earlier, where we do have validated questions, and we need to work to ensure that that is implemented as part of standard of care, not just in primary care, but also in specialty care. But even when it happens in primary care, making sure that, that addition to allergy-friendly foods is noted.
So I mean, it's an issue of, improving not just the access, but the education of the professionals that are actually tending to these families. Both you and Ruchi touched on the idea that folks need to be able to ask that next level of question, which is, we're not just handing you the prescription for the EpiPen, we're asking you, number one, can you afford to fill it? Are you managing any other health conditions that might be related? Do you have any issues with being able to get food on a regular basis? And how can we support you? Maybe we send you to the hospital social worker. So that there are certain things that I think we associate with other illnesses. We've talked about things like juvenile diabetes, where if you come in and you get a diagnosis, folks don't let you leave the hospital until you're plugged into pathways of care. And that we don't see that happening with Black families who have food allergy as a regular course of business. So that's definitely something to be able to think about towards the future. Thank you for illuminating that. Susie and Dan, I would love to hear your feedback on, you all have been very clear about steps that you've taken to share your resources and to amplify work within the Black community so that it gets known and supported by a larger audience. What kind of advice or guidance would you offer other people working in the business space about how to get involved in a productive kind of way?
I can go ahead if that's okay. So, I mean, I think, for us, we interact with, dozens, hundreds of companies. And so for us, we interact with consumers, we interact with organizations, and for-profit organizations and not-for-profit organizations. And we are having this conversation with every company that we're engaging with. We have a food company that we're going to do a big marketing campaign for them, and the conversation came up of how are we supporting people of color? And we love partners like that because it's mutually on the agenda. We are finding with some companies it's not on their agenda, and we look at ourselves to have productive conversations to raise the awareness and make sure that it's something that they're thinking about. and they look to us to have those conversations. So we are in our interaction with our partners and potential partners, asking this question and bringing it to the top of their agenda and coming up with ideas that are very engaging and fun and really thoughtful. To consumers, we continue to make sure that they are seen and it's very visible, people of color. And, we do create a lot of content around, we have created content around the Black community, whether it's Black company-owned food allergy companies, Black food allergy bloggers. We feature Black individuals in our content, like Owen Osborne. We feature recipes and we make sure we're representing a wide range of blogger content creators. It's something that every single thing we touch, we hope to lead, to be a leader in the space, to say we should be talking about this. And we try to have done this prior to, I think, this surfacing and the awakening, thankfully, that we've had. And we continue to do it. So we try to lead by it. We try to be really explicit by it. We like to promote Black-owned companies. So on Blackout Tuesday, we are extending for free our verified brand program to Black companies, Black-owned companies. And we just featured Bake Cravings, a nut-free bakery in New York, and we extended it to free. And then we're promoting his business and trying to get him business. So we're doing everything like in our power. I don't think I say that that I'm proud of the team, that we've done some things. We challenge ourselves that we can do more. So I don't say that. I say it very humbly, hopefully, of what we have done. And I feel like we need to continue to do more. And I really like what Dan said. I just want to comment on that. I really like the idea of push us. We want to be pushed. And this is not for now. I mean, we've been at this in earnest for a bit, but I want to be challenged that in a year from now and 10 years from now, we're always doing that. And I think I like what he said. But so we're doing our part where we have a voice and where we have leverage. We're trying to, hold people accountable and then lead by example.
Yeah, and I completely agree with that sentiment. I mean, I think for us, it's certainly about, again, how do we lead by example? But I think it's to me the bigger point, for us is, and why I'm happy to see so many, again, so many people on this and so many faces here, is that it has to be, if we splinter our efforts, I think we will be, less effective, which is why, I think, working with Emily, as we worked with Susie in the past, et cetera, like, how do we make sure that we're putting collectively this effort together? I think until we can kind of leverage all those resources, because again, we can have content out to our platform, but if we're not connected with Susie, if we're not connected with Emily, et cetera, I think it starts to dilute itself, right? And this is, I think this is a community that we can definitely energize. But, again, it's about making sure that we bring the right level of collective energy, to the topic on a sustained way.
And I think that raises something that's also a really important component of the ongoing conversation, is that you as white allies are having these conversations with each other without necessarily going directly through every single time the Black community. The conversation is happening about what can we do without always waiting for a particular impetus or a stimulus, that you incorporate this into the way you already think of your business model, the way that you think of your corporate social responsibility. And I think that that's something that certainly we hear from Black members of this community, is that, we want to know that we are considered just as part of, the regular business of doing business. And I see that Ruchi is back with us. This is something I know, Ruchi, that you have touched on in terms of how we approach the doing of research in general. And I would love to hear your thoughts in more detail about how this affects how we conduct medical research.
Sure. Like I told you, this has been an interest, and people do recognize it. I mean, we have a large NIH grant right now to look at differences by race, and specifically Black families and white families. And we're following, over 950 families over time, and we're hoping to continue to do this to see, there are differences in not only, how the food allergy presents, what types of foods, how it's managed, and we need to get all of that information out there so that we can really offer personalized care to families and really know what those differences are. You know, I must say, the research community in allergy really pulled together during this time, and they are very interested in participating and being a part of the conversation. And many of them, not just us, have been for a long time. Everybody does different types of research, right? If you're doing basic science on mice, there's not a ton you can do. But I think the biggest thing that is coming up is how do we encourage families, generalists and allergists, to have these conversations, to be more aware of these issues. And then also in all our research, when we start researching treatments, or now that we're doing a large prevention trial, how do we make it a priority to have Black families participate and Latinx families? You know, oftentimes they're not represented in our studies, and then we take the conclusions and we say, okay, it works the same in everyone, which we know it doesn't happen. Now, there is a lot, you know, of work we have to do to build that. There's a lot of trust we have to build based on other research that's been done, Tuskegee, et cetera. Like, this is going to be a process, but I think the biggest thing we can do is make sure that we are committed to it. And at every research study that gets sent to any organization for funding has that as a priority, that we are going to do our best to build that trust and to enroll families, Black families, Latinx families, so that we understand the treatments that we're making, the prevention strategies that we're doing, how they actually work in different populations. And honestly, you know, I've had so many conversations in the past few weeks, and I really do believe there is a commitment towards this. And we need to, like I said, take this momentum and really create real change moving forward.
No, thank you for, you know, illuminating that, because it really is about creating a new baseline standard of how we approach getting the information that's needed to treat people in a way that's going to produce effective results. And definitely, since we're in a time when we're talking about how can we treat food allergy as opposed to just saying avoid the food, having that information is going to be critical to developing treatments that are actually effective across the board. Emily, is there another question you want to pick out? Because we've just been kind of rolling along and I'm keeping my eye on the clock. Anything else you see in the chat box you want to particularly pop up right now?
Yeah, so there was a question regarding clinical trials. So I'm really glad that Ruchi, you were able to illuminate that issue. We also have a question regarding someone who does not live in the US, but is wanting to know like what can be done to empower others and work with systemic change in other countries, and in kind of balancing, you know, the individual versus, you know, the systemic changes. So like the individual versus the system. So those are the kind of the two questions we have in the chat.
Do you want me to say something? You want me to
Anybody
answer?
who's got a thought.
Okay. All right. Well, you know, there's an international meeting going on right now, WISC, and I was speaking on it yesterday, and there is this movement is across the world, and it was really nice to see. So people were discussing the disparities that exist across the world. So I think, you know, living in other places, you know, we saw protests happening everywhere, and I'm hoping that this idea, obviously different places in the world have different populations, but I am hoping this will be a movement that spans. I will say system change is really individual change. I think everyone needs to make a commitment to look at themselves, right? That's the first thing we can do. Really understanding what kind of implicit bias exists in ourselves. And I know we're committed to doing that in our center, and our university is having real discussions, and I think academic institutions all over the world are, to understand what our systems are doing to cause this institutional racism that we see. We're having conversations about, you know, how do we even hire, who works at these institutions, and to, you know, research to clinical. So that comes from, I think, each center, each company, everyone has to be committed to looking at themselves as a system, but also as individuals.
Yeah, I would definitely piggyback on what Ruchi said. I mean, it really starts first with ourselves, like you said, looking internally and really kind of stepping outside of oneself and looking for those biases. And I'll even say that, you know, because racism has been systemic, it's even internalized. I mean, Harvard has there's a like implicit bias test that you can take, and I had an opportunity to take it during a training opportunity that I had a year or so ago. And, you know, even I have implicit biases against Black people. And so I think it's important for us to know that this is not just a Black or white thing, that this is shaped kind of all of our lives kind of in the background. And so it really starts with the individual, and then again, looking at those systems and what we can do to dismantle barriers within those systems.
That's such a huge point, Emily, because I think, you know, things like the Harvard test and other, you know, things that have been publicized over the last few weeks have made people realize that racism itself is not so much about the behavior, but the structures that, you know, create an entire landscape for how we form attitudes. And so everyone has to do work in order to overcome the effect of how we were raised, what we've been shown, what our backgrounds are. So this is an ongoing conversation and ongoing work for everyone that wants to, you know, engage with these issues. One thing I wanted to, yeah, go ahead.
I'm sorry, I just want to share a quick thought, if I may. And a lot of people have asked us, you know, why were we kind of on this early, or you know, and I just want to share something that I think anyone who's listening to this webinar is obviously leaning into the topic, and obviously everybody on the panel is just, you know, I have huge respect for, of course, everybody who has stepped up. But I think something is living with it's just within the food allergy community alone. Everybody here is touched by food allergies, and everybody knows. I mean, I can just tell you, when somebody who doesn't have food allergies helps your child, when they make sure the birthday cake is safe, when they let your child sleep over and they're going to take care of that for you, the camp counselor, the teacher, you know, whoever it may be, that is an ally, you know. And when you are on the receiving end of someone who allows your child to have as much of a normal experience as possible, that feeling that you have, to me, is those are like the heroes for me that have, you know, the story of someone having a birthday party where all of the ice cream was dairy free so that the one child could feel like everybody else. Those people are allies, and we all, I think, know what it feels like to be the recipient of that. And I think if everyone just understands, because we've all received that, to know what it's like to receive that, to give that out in the world, when you talk to your children, when you talk to companies, when you talk to anybody, I think that is such the most powerful example, because we all know firsthand what that feels like. And to think about just leading with kindness, I think is such a great driver. And there's nobody, I don't think, in the food allergy community who doesn't know what that feels like to receive it. And I think that's something you can teach our children, teach anybody. And I just wanted to point that out, because it's been the thing that's been so, it's just so tangible, because I think we've all experienced it. And just think about that. It's just I don't know, I just wanted to share that, because I found in talking to our consumers on our app and talking to so many of our ambassadors, and everybody really gets it. I just wanted to share that, if that's helpful for anybody.
That's actually, it's a wonderful thought, Susie, because I think the hope of all of us here who is, you know, you point out we are all personally touched by food allergy. I'm a food allergy parent as well. We would hope that people would look at people in the food allergy community as being worthy of support, whether or not they have a connection to the community in a formal way. I mean, people contribute to fundraisers for breast cancer, for juvenile diabetes, for a range of other, you know, health issues where they don't have a personal connection. We would like people to be able to look at folks in this space as being worthy of that support, just because we're fellow human beings that need it. And so I think that's a great thing to be able to put out there. You know, if you want to be an ally, you don't have to be touched by this on a personal level. You just have to care. I think, Joanne and Lewis, this leads me back to you, because a large part of the reason you created your foundation was to honor your daughter. And, you've talked about, how Natalie's spirit informs the work that you do. And I wonder, thinking, through her eyes, through her personality, what she would say, what it means to do the work that you're doing right now.
Well, we have spoken often about her strong spirit. And I think we lost her, it's been almost 7 years ago. One of the things that was important to both Lewis and I was the fact that we continue to honor her. She might not be with us, but that we needed to make sure that we continued her legacy would have done. And so we've tried to find projects to support that make a difference in the lives of those who, the journey is not always as easy. And Natalie had a spirit of giving as a 13-year-old. That was incredibly important to her. Volunteer time, donate her own money to causes. And so, when we met Emily, that first conversation, we literally got off the phone and I knew that Natalie had pointed us to Emily. So from that perspective, and I kind of layering on to what Susie said too, as a community, the food allergy community is a passionate, caring, giving community. And I think all of us want to help one another and give one another a leg up so that we can make that journey a little bit easier for the next person. And so I think Natalie's spirit directed us towards Emily, and it gives us a purpose. I mean, being able to, as Lewis said, we're humbled and honored to be able to support her work. And in so many ways, it really gives us a chance to let our child's spirit live on. And so I encourage whatever motivates people to Susie's, that we continue to do it, and to Dan's point, that we continue to show up. And not just today and not just tomorrow. And Emily and I had a conversation about grief. It's the same sort of thing. Be here today, be here 6 months from now, be here 7 years from now. And I think if we do that, we will all make the world a better place. So.
No, thank you. That's a wonderful thought to plant. It's a seed that we hope we're planting with everyone here today to take out and share with other folks who want to engage with these issues and be supportive. Emily, I know our time is coming to a close. I wanted to ask you, we've talked about so many different things in terms of ways that people can amplify and support organizations like yours, individuals who are coming with ideas that support the Black community in food allergy. What other thoughts do you want to leave people with about what's really needed at this time when we are having tremendous social upheaval and, frankly, a lot of very serious economic challenges?
I would just remind people that right now it is so critical that we truly harness the power we have together as community to support those that are most vulnerable. And, of course, it's not just supporting Food Equality Initiative, it's supporting other leaders in our space, other Black-led organizations like the Elijah Alavi Foundation and others who are doing such critical work that are just really truly leading the way. And I do want to acknowledge very quickly, I know during our last conversation, we announced the forming of the 7% Fund in Coalition, and we have had several companies and individuals support this effort. And I just want to say thank you to them and just encourage others to join. And again, it's not just a fund. And to piggyback off of Dan's words, it's really about taking this from more of a moment to a movement and really pulling everybody together for action for sustainable change. So just again, thank you for being here today, and just thank you for just coming together and having this critical conversation.
Yeah. Thank you so much for bringing us, Emily. Sadly, our hour has flown by, and we're out of time, but I want to thank everybody for, number one, being here. I know we're going to be continuing this conversation both on social media and in our next gathering next month. Details will come. Keep your eyes on your inboxes for material from FEI and an invitation to the next For the Health conversation. So we would like to thank all of our panelists, Joanne and Louis Giorgi, Dan Waters, Susie Hultquist, Dr. Rucci Gupta. You know, Ruchi, your persistence in making sure you got back there, that's the extra hustle. Thank you so much. Your voice added a lot to this conversation. We would also like to thank our sponsors, Enjoy Life Foods, the Natalie Giorgi Sunshine Foundation, Spokin, and the Center for Asthma and Allergy Research at Northwestern University. And a very, very special thank you to Emily Brown for getting us all in the same room and online together. We especially want to thank all of the families out there living with food allergies. The work we do together will create a safer, healthier, happier world for every single member of this community. So once again, thank you for joining for the Health Part 2, a conversation on race and food allergy, and we will see you all again very soon.